Well, in general, the risk for severe illness from COVID-19 increases as you get older. People in their 50s are at a higher risk than people in their 40s, and people in their 60s are at higher risk than those in their 50s. Certain underlying medical conditions may increase the risk of serious COVID-19 disease for individuals. And of course, let's get to understand this more. We're joined via Zoom by Dr. Vicki Pinkney-Atkinson, who is the director of the South African NCD Alliance. Good afternoon to you and welcome.
Thank you so much. I hope it's not going to echo like this. Okay, so we're on. Thank you very much for having me. I see that my screen is a bit skew and I'm trying to fix it here. Oops,
it's okay now. Yeah, thank you so much. Stay right where you are.
Okay.
Stay right where you are.
Okay.
Let's just look back.
Don't move.
Right. Let's look back.
So I would like...
Let me speak to you. Listen to what I have to say first. Well, you are okay where you are. I wanted to start first by reflecting on 2020. And of course, looking at the impact of COVID-19, specifically looking at people with comorbidities. How do you think the government and we as a country have handled COVID-19 in relation to this specific problem?
Thank you, and I'm sorry for being such a difficult person to start with. So, first of all, we want to mourn the loss of all of those people, and in many cases, at the healthcare workers who've done their work. But really, 2020, in many cases, is a missed opportunity for people living with conditions that are not prioritized by the government. In many cases, we knew that the Eastern Cape was going to be hardest hit because it had the oldest dependency ratio and oldest people. And yes, exactly, and it had one of the poorest health systems. So none of that is a surprise. I'm a person living with non-communicable diseases. I have about 20 of them. And I'm really very, very tired from 2020 is hearing the Minister of Health and all of the officials and the news department saying all over again every time the comorbidities that we have to consider are HIV, AIDS, and TB, and malaria at one stage. That was really a great shock. But that really isn't the truth, and we need more clarity and transparency from our government to tell us what is going on.
So when you talk about that clarity, in fact, I wanted to find out from you about whether we know if certain vaccines would be okay and appropriate for people over, say, the age of 50 and 60 to take vaccines, and if they would feel comfortable with doing that, and is it safe to do so?
So I think really the issue is the people over the age of, the research appears to be clearer with the J&J trial and with the South African variant that it reduces severe disease and mortality. It's not as efficacious as some of the big studies with the AstraZeneca and the Pfizer. The Pfizer one is very hard to deliver in a low and middle income group setting. So I can't comment entirely on all of the age groups, but it seems that the J&J vaccine is the best for our circumstances and our population at this time, at what's available and what we can buy.
Do you remember many people were complaining when we were reporting a high number of deaths, and some bereaved families were saying that they were actually having a problem with the generalization that every time when somebody passes on in hospital, they would be categorized as having died of COVID-19. And now when you look at the report of the South African Medical Research Council's data, it shows that we have more than 145,000 deaths, which were not actually reported in that line of reporting, that these were excess deaths. And do you think that they translate to the deaths as a result of COVID-19, or was it just generalization as people were suspecting?
I think, Colin, one of the important things to know that in South Africa, we do not have adequate statistics for health conditions other than HIV and TB and some maternal mortality. And when we talk about in-hospital deaths, we're probably pretty sure of what we've got. But outside of the hospital, it could be, I was listening to Professor Salim Abdul Karim speak this morning, and he said it could be double, it could be quadruple. So we really don't know. And I think it's a bit laissez-faire of what he was saying, because really our lives matter a little bit more and it's about time we actually get it right. What I'm showing you on this particular, there's no doubt that there are more deaths than we have, and we have always had a problem with deaths outside of hospital not being counted properly. Stats SA has said for years it's going to fix it. It is time that it is done. And what I'm showing you on the screen is data. The green part are admissions to hospital, and those are the only statistics we can really rely on. And I want to show you that the green part are things we call non-communicable diseases. You can see that the biggest chunk of them here are non-communicable, high blood pressure. Diabetes is number 2, heart. All of this area here are really the same kind of illnesses linked. The smaller part is asthma and COPD. But look at the tiny proportion of deaths that are due to HIV and TB, and that's what our ministers have spent their time talking about and measuring, and not talking to the real issues in our country. And this data that we have here does not show the conditions that are related to obesity, because even the data says that they cannot measure it and they have forgotten to measure it. So that's a kind of a problem that we have, and I would like to address that. Would you like to ask a question?
Yeah, I actually wanted to find out if you suspect that the number of deaths sounded a little bit exaggerated and overstated.
Look, I don't think the number of deaths are overstated or exaggerated. I think this is a real illness. What we are dealing with in this country is an epidemic of the green illnesses here that have been neglected and not treated and not cared for in our country for a long time. There is no budget to manage these health conditions. The only budgets in the health department that exist are for HIV, TB, and those conditions. And so they even have to go in this slide to look at whether you've had TB in the past. So really, I think they're stretching a whole long thing. The government, the Department of Health has been silent, and silent to the majority. These green group of diseases, the things that are not infectious, are the things that kill most people in our country before COVID. They're killing the most people in COVID in the country now, during COVID, and they will do the same thing afterwards. And it's time we got a health system that took care of all of the people, not just some of the people. Thank you.
All right. So when you look at the rollout process, priority was given to frontline workers, especially in the healthcare sector. When we get to phase 2, do you think the elderly and people with comorbidities should be prioritized, or is there any other way where you think this way the government can actually look at people who are most of the time congregating, that essentially they would be able to get the vaccination so that they do not possibly infect those who are with comorbidities and the elderly?
Thank you. What a brilliant question. It's a question I've been asking government for the last months since they talked about vaccine rollout. And to date, I've not had any answer with any clarity. I think that it has to be stopped. We have to stop having a command council and have real discussions with real people who are actually on the panel and the vaccination panel. You are quite correct that phase 2 involves many more people than in the tiny phase 1 that is being rolled out now, and it may be a trial or may not be a trial. I would like more information, and I would like time to go by and the realities to come out. However, phase 2 is where people who live in congregate settings, that means close by settings, are going to be taken care of. And that's not just prisoners, as some people say. It's people living in close conditions. It's for the elderly. We know very clearly there are about 5 million people elderly in South Africa. What we don't know and is those comorbidities. They keep talking about comorbidities, framing it in terms of HIV and AIDS and TB, when the biggest killers, and the data is not collected globally, we know that obesity is a major factor with causing severe disease, getting sicker and dying. And so we have 70% of our population, our female population, adults, are obese in one way or another. So what we really need to do is to have, if it's 70%, it's nowhere near the number. We're completely underestimating the comorbidities. And you saw the figures for hypertension. So we're at a very, very critical phase where they've got to come clean and say what the hang is going on, because there is nowhere near enough vaccination to do everybody straight away. And so there has to be a clear and transparent way of prioritizing it down to the district system. And it has to be done equitably. It cannot be done on a rich man first. It's got to be done where the greatest need is going to happen and where we can get the service to the people that need it the most. And that's the problem. We have no idea what's going on in phase 2. The government has been silent. It remains silent. When I ask the press corps, they're always, It's not okay. And we must stop this command council nonsense where we don't talk to the people properly. And it's no good to have a patronizing little thing like we're talking to our dear family meeting. It's not a bloody family meeting. I'm sorry to say that out loud on TV. It's not a family meeting. We've actually got to have clear and transparent. We're not children. We're not your children. We need to know. It's our health. And I use the public sector, and I want to know how I'm going to get mine without killing myself by going to get the vaccine in the first place.
All right, I can hear you speaking your mind and, of course, raising a very, very pertinent issue here. So in our further discussion and engagement with government and experts, we will actually look into this matter of comorbidities and, of course, that dichotomy that you have just described on the exclusion of other comorbidities and looking at HIV and TB. And of course, that is a very crucial question in terms of budgeting for the treatment of those diseases. Thank you so much for making time to speak to us.